Hi, my name is Brittany Hicks, and I will be presenting my patient case study on an asthma patient. DR is a 27-year-old man who was born prematurely at 6 months gestation due to his mother having an intrauterine infection. Both of his parents are living. His 51-year-old mother suffers from cervical cancer and had a partial hysterectomy, and his 50-year-old father is suffering from perennial allergic rhinitis and is allergic to pets. He has no siblings, and his grandparents, including his paternal and maternal grandfather, as well as his step-grandfather, are all chain smokers. DR's social history: he's not an alcoholic or a tobacco smoker and is currently married with 2 biological children and a stepson. He is a college graduate with a degree in business and currently works as a business consultant with a private firm, like his father, who he is not a fan of pets. DR's past medical history reveals that he was diagnosed with asthma when he was 18 months old and has had moderate persistent asthma ever since the age of 19. Here in the picture below, you will see a normal airway for a normal patient that does not have asthma compared to an airway where a patient has had an asthmatic attack and there is narrowing of the airway. DR needed a visit to his doctor, so he visited the nurse practitioner. He complained of increasing shortness of breath, wheezing, coughing, stuffy nose, watery eyes, and postnasal drainage that he had been suffering with for 4 days. The picture below shows signs and symptoms of asthma: difficulty breathing, wheezing, coughing, as well as exercising being induced asthma, occupational induced asthma, allergens like pets induced asthma. DR began using his peak flow meters 3 days into his symptoms. His ranges were between 200 to 240 liters per minute, where his baseline had been 340 liters per minute. He began to self-treat with albuterol nebulizer treatments, which he had been prescribed since he was an asthmatic. Normally, this would provide relief for him, but at this time, it provided no relief, so he decided to go into the doctor. Below are 2 pictures of peak flow meters. Many asthmatics are prescribed peak flow meters so that they can keep a track of their lung function when there is an asthmatic attack. Here in this graph, it shows asthma and the different things that can contribute to an asthma attack, whether or not it be the pollutants, whether it be allergies, smoking, the environment, dust, dander, exercise. When one suffers from an asthma attack, the practitioner will examine the patient. The physical examination and the laboratory tests confirm his complaints. The tests revealed that he had had an agitated and has had a moderate degree of respiratory distress, wheezing with his cough, eyes, and watery eyes and nose, shortness of breath when talking, that he prefers sitting to lying down because it helps him, and it also helps him to speak in short phrases to where he doesn't lose his breath. In this case, the presumptive diagnosis is that DR has asthma, which can be categorized as moderate persistent asthma. Risk factors for asthma. One of the risk factors for asthma is exposure to chemicals used in farming and manufacturing and the exposure to exhaust fumes and other types of pollution. The exposure to such often provoked cough and lower respiratory symptoms such as exercise-induced wheezing. In addition, asthmatics can exhibit exaggerated responsiveness to lower respiratory infections that frequently trigger wheezing attacks, which are some of the major symptoms of asthma. Low lung function is another important risk factor for persistent asthma, witnessed in the case of DR. Studies show that low lung function is associated with wheezing, which is one of the signs and symptoms of asthma. In the diagram below, there are asthma triggers: a cold, strong odors, pollution, pets, exercise, bugs, rodents, and chemicals, as well as smoke, can be asthma triggers. The pathology of asthma as it occurs over time. Asthma is one of the common pulmonary conditions that is associated with episodes of bronchoconstriction, the tightening of respiratory smooth muscles, and the chronic inflammation of the respiratory tubes. Here you will see a diagram of healthy tubes and unhealthy tubes. When it comes to the bronchoconstriction, the airway of an asthmatic individuals are often sensitive to the triggers that are also known as stimuli. While responding to the triggers such as smoke, dust, or pollen, the bronchi often constrict or contract into a spasm. This is also followed by the inflammation that leads to the narrowing of the airways, as well as excessive production of mucus. In turn, these result in persistent coughs and breathing complications witnessed by the asthmatic patient, our patient DR. Asthma is also associated to a condition known as bronchial inflammation. The inflammation results from the production of chemicals that cause the walls of the airways to thicken. Also, bronchial inflammation causes the growth of mucus-producing cells that result in the production of more and thicker mucus that can make someone's breathing difficult. Signs and symptoms of asthma. People with asthma experience common signs and symptoms such as coughing, particularly at night, wheezing, chest tightness, or pain and shortness of breath. Other symptoms include feeling tired or fatigued, decrease or change in lung function, as well as cold or allergies that result in sneezing, runny nose, cough, and nasal congestion, headache, and sore throats. Other individuals with asthma often report having trouble when sleeping. Most of these signs and symptoms are similar to those seen in the case of DR, whose presumptive diagnosis indicates that he is an asthmatic. Diagnostic studies for asthma. There are several diagnostic studies for asthma. First, a physician might discuss the patient's medical history with the patient and perform a physical exam, like listening to lung sounds. For instance, in the case of DR, the medical history revealed that he was diagnosed with asthma at the age of 18 months. And with that, he has moderate persistent asthma since the age of 19. With this information, the physician can diagnose DR with asthma. Second, a physician may also perform a lung function test to determine the functionality of the lungs. An example of this function test is performed. Also, a physician may also conduct other tests such as a chest or sinus x-ray. Below is a picture of a patient performing a lung function test where they blow into a machine and the machine interprets the data. Here on this slide, you see a chest x-ray with a picture of a patient that has asthma, and the abnormal findings are present. Treatments and outcomes for asthma. Before treatment, prevention and long-term control strategies are crucial to stopping asthma attacks. So avoiding the triggers, recognizing the triggers, and taking steps to avoid them, as well as tracking one's breathing. However, medications such as inhaled corticosteroids, leukotriene modifiers, long-acting beta antagonists, combination inhalers, and theophylline may be used to treat asthma. The outcome is that these types of medications can keep asthma in control. Below are pictures of inhalers, a nebulizer treatment, as well as an inhaler attached to an aero chamber. A lot of times people take their inhalers incorrectly and they don't inhale the medication. So using an aero chamber to make sure that you are putting your mouth around it and inhaling the medication can sometimes be of help. It's very important for asthmatics to know their triggers and to try to control their surroundings to limit their asthma attacks. Thank you for listening to my presentation. Hope you learned a lot. Have a great night.